Hello, everyone, and welcome to Heads Up, the weekly podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, chronic daily migraine survivor, and founder of the Facebook group Migraine Nation. I am super excited because I'm here today with one of my favorite people. This is Jaime Sanders. Hi, Jaime. How are you today?
Hi, Lindsay. I'm doing well. Thank you.
Many of you probably already know who Jaime is. Jaime is known as the Migraine Diva. She has a very popular blog where she discusses battling the two beasts of migraine disease and depression at the same time, and how she rocks life as a mom and a patient advocate as she works to live her best life with both these things going on. And she does such a great job. And she's very popular, and every time I talk to her, I learn more and more. And I know you will all learn a lot today as we chat with her. So without further ado, let's start talking to Jaime. So Jaime, how are you doing?
I'm doing great. Thank you.
Oh, okay, good. The first thing I wanted to ask you, I always find this very interesting when discussing this topic. And this topic, as I think you agree, is just not talked about enough in the migraine community, the topic of depression. And people with migraine are at least twice as likely, and oftentimes reported 5 times as likely to have depression than the average person. So I wanted to ask you, in your personal story, when did your migraine and your depression start? Did they come simultaneously or did they come separately?
Well, looking back retrospectively, I can definitely say that I was experiencing depression when I was diagnosed as a child with migraine. I just didn't know what it was. My parents used to always call me melancholy. I started writing poetry at 8, and it was really like depressing and sad. And that's just a way that I can get my feelings out.
Right.
And I just always felt very alone and isolated. And I guess that had a lot to do with living with migraine at such a young age. And I didn't realize that my inability to feel happy was actually depression. But I wasn't diagnosed officially with depressive disorder until I was in my early 20s.
Okay. And how old were you when your migraines, or as far as you remember, when they started?
Well, I was diagnosed when I was 8 years old,
Okay.
but I can definitely tell that when I was a toddler, around 1 to 2 years old, 3 years old, I definitely had abdominal migraine.
Right. Okay. So we were similar in that manner. Yeah, I don't have my memory without migraine. Yes.
Yes.
I know how that goes. So there's something very important that I remember. You gave this great talk at Retreat Migraine. And one of the things you were saying was that you use vocabulary when you speak about depression that I think the listeners should be aware of. You say things like you're experiencing a depression flare instead of saying that you're depressed. Can you tell us why you think that's important?
Sure. This is extremely important for me not to personify my mental illness. And this goes back to even how clinicians describe mental illness to their patients. It's just common vernacular to use words like I am depressed, I am anxious, I am experiencing compulsive, obsessive behaviors. So we manifest these symptoms and we personify them and make them part of our personality.
Right.
And that really is not the truth of who we are. That is not the core of our being. And in order for me to disassociate my disease from who I am as an individual, I had to change the language that I was using to describe my symptoms, because that's what they are.
Right.
They are symptoms. They are not manifestations of my personality or any characteristic of who I am as a human being.
Right.
So just like there is an arthritis flare or a fibromyalgia flare, it comes and goes, and sometimes they last a few days, sometimes they last a few weeks or a few months. But that's what they are. They're flares.
Right.
So I'm having a depression flare, and I really try not to use the words that I am depressed, or I could use words like I am having feelings of depression.
Right.
and just calling it exactly what it is and taking the onus off of myself.
My next question is, does your migraine disease make your depression worse, and vice versa? Do you think the depression flares make your migraine worse, or do you find that you experience them entirely separately?
They definitely correlate with each other. So
Okay.
the longer that I'm in an intractable migraine status, the more likely that the depression flare is going to get more severe and last longer and be a little bit more difficult to come out of.
Right.
Because the longer I'm in pain, the more it's impacting my mental health. Because I'm spending more time in bed, inside the house. I'm not really experiencing any social activity. And, you know, migraine is doing its thing and being a thief and stealing so much away from my life. And that, of course, is going to impact how I feel mentally. And having a mental illness, it's going to, you know, definitely impact the depression. So they definitely correlate each other. If I'm having a depression flare, I'm not necessarily going to have an increase in migraine.
Right.
But definitely the increase in migraine is going to trigger a depression flare.
I once heard you say something that resonated with the way my philosophy on personalities of people that deal with migraine. So I wanted to bring it up. I mean, I'm going to read it because I want to say exactly what you said. You said that people with migraine are the strongest people in the world in order just to get through the day. I love that you said that. It almost gives me chills because it's exactly how I feel. I think it's so true. Can you comment on that?
Sure. I think every time we wake up in the morning, we have to make a decision about what we're going to try to accomplish that day, because we are limited in what we can do. We have to pace ourselves. So we have to be very precise in what we choose to expend our energy on. In the morning, I try to give myself between 2 to 3 things that I can accomplish in that day. That's going to make me feel good about what I'm going to do the next day.
Right.
So by the time I lay my head down at night, it doesn't have to be anything super heroic, super productive, even if it's just getting a load of laundry done and emptying the dishwasher.
Yes.
If that's all I can muster that day, if I got that done, I feel good about myself.
You have said that you are not your illness. And you touched on this a little earlier, but can you just comment on why this mindset is so important to you?
When I was going through my journey after a really severe depressive episode 6-7 years ago, and working my way through that and trying to crawl through the darkness, I had to look at my life differently and how I approached my illness and how I perceived it. And I had to completely separate myself from migraine, the fibromyalgia, the depression, the anxiety. And I had to say out loud to myself, I am not these things. I am still Jaime. Jaime still has purpose. Jaime still has vision. Jaime still has value and worth. Even though these diseases make me feel like I don't have those things, that's not true. And what the depression tells me that negative self-talk is not true. What the anxiety makes me feel is not true. And I really had to do the work to really invest in that positive thinking. And it took a couple of years, but it's really worth the time that I spent to really invest in myself and self-care. And I encourage everybody who lives with any chronic illness to really take that time for themselves to separate what they're experiencing from their illness from who they are as a human being. Because it helps you manage with your pain better. You find healthier coping mechanisms. You can let go of a lot of guilt. And you give yourself permission to have days where you're not okay, as opposed to before. And it really gives you this release that you didn't have prior to, when you were so engulfed in the feelings of being useless, worthless, incapable, all these feelings that having multiple chronic illnesses makes us feel every day because we're so burdened down by them. Letting that go and understanding that that's just, part of, what I'm dealing with, but is not a part of who I am. really is a source of empowerment. And when you gain that empowerment, then you can really run wild with that. And, you know, you advocate better for your health and you speak more freely with your doctors. And it really opens up doors for you in the space of your healthcare.
You say that battling migraine and depression together is like battling two beasts. Can you comment on that?
Well, they both have this cyclical personality to them, especially having chronic intractable migraine. That's every day in pain, and some days are way more manageable than others. And then I have times where I'm just down for months. And when that happens, the depression really kicks in high gear. So I have to really do a lot of work to manage the both of them. And it's extremely exhausting because it takes a lot of mental strength to not give in to the both of them when they're coming at me at the same time. And it's very, very difficult. And it's very easy to understand why people succumb to the negative feelings that come with being in severe, intractable pain every day and not getting relief and not having anybody to support you through that and help you get to a healthier place. It takes a lot of determination. It takes a lot of working your healthy tools. The physical exhaustion that I feel is overwhelming. And it's very straining on myself and also on my family. It doesn't just affect me. It affects my husband. It affects my children. Of course, they don't like to see me down in pain or having feelings of depression. I'm very honest and open with my children and my husband about how I'm feeling. I don't hide it from them. Being honest with them helps them support me.
Right.
And it takes away the guilt of me feeling like I have to push through that to try to be the perfect wife and mother. And it allows them to embrace me with my perceived flaws and still accept me and see me as a perfect mother or a perfect wife. And therefore allows me to see myself in the same light that they see me in their eyes.
I think it makes you a very strong mom, a role model, and partner to look at it in that light and to be honest that way. Because it is a very difficult thing to figure out how to be the sick person in the family and still be a strong person. And I think you embody it and do it so well. And I love that message that you just gave us.
So we really can't be the caregivers to our children and the spouses or significant others to our loved ones that we want to be if we don't take care of ourselves first. And we deserve to take care of ourselves. And a lot of times as women, we feel like that's too selfish of us. But that really isn't. That's the best love you can give yourself. Self-love and self-kindness is so important. So that's my important message. If there's any key takeaway today, really invest in self-love and self-kindness. And doing like a simple 5 or 10 minute guided meditation on self-love and self-kindness once a day in the morning or during your lunch break, just to remind yourself to be kind to yourself.
Right.
It's very beneficial to your mental health and your chronic pain as well. Helps you manage with life just much better.
Awesome message. Thank you. So Jaime and I both wanted to get one last message across before we close on Heads Up today. We have both lost friends, loved ones, people close to us in the migraine community due to depression or just the inability to keep up or handle the pain that we are in. It does reach a point where people find it difficult to keep going. And we are dealing with a very painful disease that it will affect your emotions no matter how strong you are. There is no way you can have chronic migraine and have it not affect you emotionally. And so we want to make sure that we leave you with the National Suicide Prevention Lifeline. Not only that, But we want to make sure everyone knows that at this point, there are so many people in the migraine and chronic pain space, so many more than there used to be, that are there to help us. We have people you can go to that are counselors that specialize in helping people with chronic pain. There's strategists, there's migraine strategists, pain strategists. There are obviously headache specialists. So there's so much more available to us now, and none of us should ever feel alone. There's also support groups. So that line is 800-273-8255, which is 273-TALK. So always know that it's there. Never feel alone. And try to keep yourself in as empowered a space, and always make sure you're involving yourself in self-care. So we want you all to take good care of you, feel powerful, feel positive, and feel well. So here's Jaime and Lindsay signing off this week on Heads Up, and see you next week. Bye-bye.